basically, when someone, takes the time to recount an experience, it speaks volumes. And so I appreciate your consent to share your story with me today. And my first question for you this morning is, as a traditionally trained physician, I know you're a doctor of osteopathy, but still that definitely falls in the category of traditionally trained. How comfortable do you feel referring patients to me?
Well, first of all, osteopathy is just a general term. My specific specialty is physical medicine and rehabilitation. So I'm board certified in PMNR, and you can get that degree whether you're an MD or a DO. And DO is osteopathic physicians. It's about 20% of the physicians in the United States. And having said that, I'm very comfortable referring to somebody like you because it melds with what I do also. This is the most, even though it's allopathic medicine, this physical medicine, it's probably the most similar to what you do on a functional basis. I do that on a physical basis with these patients, patients who need rehabilitation from various issues, whether it's pain generated or any other musculoskeletal issues. And therefore it lends itself perfectly to what you do on the inside. And so that's why I'm very comfortable doing it. So physical medicine and rehab is probably the most untraditional of the traditional medication, medical specialties, and that's
Sure.
why I'm comfortable.
Sure, I appreciate that. And with my background in chiropractic medicine, obviously, I feel it's tremendously important to have a hands-on approach. And so the fact that your profession exists and the way that you guys handle patients is tremendously beneficial to the population. So thanks for all you do.
Thank you.
Question number 2. How confident are you in my protocols, the internal protocols, the functional protocols, if you will, and my philosophy when it comes to treating chronic ailments without drugs or surgery? Or, that's a little bit of a loaded question because I'm also a big fan of co-management. And I also feel that my treatments are not a replacement for drugs or surgery, but that caring for a person from the ground up in the way that I do with microbiome and micronutrient evaluation helps a person even respond better to medications and respond better to surgery. I'm sure you've addressed the concept of prehab with patients as opposed to just rehab. So again, clarity on the question, how confident are you in my protocols and my philosophy when dealing with chronic disease?
So I have happened to have seen those protocols firsthand, and it's amenable to good health and to find the root of problems, which is what I like. In other words, if I can't find the root of a problem, I don't know what I'm treating. I'm just treating symptoms.
Sure.
And unfortunately, today, allopathic medicine is just treatment of symptoms. And that's what it is. The whole medical school conglomerate has been controlled by big pharma, and we know that. They actually bankrolled us, I don't know how many years ago. And that's what happened. We're tuned in to symptoms and treatment. Everything has a symptom, every disease has a symptom, and every symptom has a treatment, either a drug protocol.
Sure.
And I really, I loathed that part of my school. And most of the education I received afterwards went counter to that. And I just read more and more. Of course, biochemistry is probably the most important course that I took in med school.
Sure.
And physiology. Those were the most interesting, meant the most to me. It was the most meaningful to me from that standpoint. So I'm very comfortable with this whole concept.
Amazing.
And so I've seen them firsthand, the protocols. It's biochemistry live. That's what it is. And I love that.
Awesome. Thank you. So we've also accomplished that next question. So let's skip to number 4 on my list here is, and you kind of answered this too, but do you personally think that there's a need and a benefit to bring microbiome and micronutrient evaluation to the greater public and mainstream, and why? And you've answered that, but essentially, we've used a term like functional medicine, and I feel what I've done is I've distilled down functional medicine to a personal system, to a proprietary system where I'm focused mostly on those aspects, the microbiome and the micronutrient. And I feel I personally feel it's a tremendous gift to humanity to be able to, reach that to as many people as possible so that they can have a better quality of life. So I think you agree. It sounds like you agree. So yeah, that's the question. Do you think there's a need for this for the greater public?
There's absolutely a need. Again, it goes to the point that there are pathways in the human body. We don't know all of them. We know
Sure,
quite a bit. We know
sure,
quite a bit. And those pathways are loaded with interventions that we can do as practitioners. And that's what you're doing. And that's why I enjoy functional medicine. That's what it's all about. In fact, I really think in the future, those are the real docs, the real doctors who get to the ichor of what's going on, the source of what's happening, the
sure.
core.
Yep, yep,
And yeah, the microbiome, we all understand there's a gut-brain connection. The gut is involved with everything. The only connection we received in med school about the gut was that, oh, if you give antibiotics, you'll inhibit the bacteria which make vitamin K, and you have to watch about coumadin levels. So that's the only microbiome that we discussed in medical school and in residency. Oh, be careful about antibiotics when somebody's on coumadin or warfarin because of what I just told you. I said, oh,
sure.
well, that's fascinating. Imagine that's one point. Imagine how many hundreds of thousands of points are in existence because of our microbiome and how it affects our brain function, pulmonary function. So I see this expanding to many symptoms that a person can have and many diseases a person can have. And you'll find a source, you'll find a problem, whether it's the hair analysis, whether it's a stool, whether it's the way you check blood for various things which are not tested in routine labs.
Sure.
It's just amazing. Just a simple concept of, homocysteine levels in the heart, it's,
Yep.
we know there's a problem there. So you have to use nutrients. They mentioned 3 nutrients, which we know directly lowers homocysteine levels. So test them, give them. I mean, nobody does this, They
Right.
just treat cholesterol levels, that's what they do.
No,
So I'm
it's
very,
fascinating.
it's absolutely 100% true that this microbiome and micronutrient technology that we have is extremely important in furthering our information about disease.
Amazing, amazing. And maybe, I see now that maybe there's a potential, this is not the time or the venue for it per se, but maybe we could do like a different, call it a different time where we go deeper into that, like the question of why, if, why is that the only thing that's discussed, in medical school at the time. And I don't think it's progressed a tremendous amount more yet, unfortunately. But for example, I have a patient that I'm co-managing with quite a team of physicians, and I found it very interesting that certain things I was bringing up, which were totally from a couple other medical doctors were 100% in agreement, but there was a couple medical doctors on the team who were like, "There's not enough research," and I simply said, in this particular case, we don't really, there first of all is a lot of research, and we don't have time to wait. Like in some instances, these therapies are so non-invasive. What are we afraid of? But anyway, we'll deal with that at another.
Nothing to lose. Great.
Yeah, exactly. Okay, so the last question, I think we've covered this too, so we're pretty much done. But would you recommend my services to people suffering from a range of conditions as a treatment, but also as a supportive role in multiple diagnoses affecting human physiology? I think we've covered that. We don't need to be
100%.
redundant. We don't need to be redundant at
100%.
all.
I've had personal experience, and hopefully we'll continue doing that. And it's our pleasure, and other people should be exposed, to this kind of treatment protocol, because it's
Amazing.
really holistic with a W, big W.
Totally. Well, listen, I really appreciate your time, and I look forward to continuing to work up cases with you and help everybody that we can get our hands on, so to speak. And thank you so much, and have a great day.
You too. Have a great day.